Hello, I would like to welcome you all to our next session, Integrative Medicine, a Combined Approach to Care. So remember, we will have time at the end of this presentation for questions. So please, if you have any questions, you can enter those into the chat box on the right-hand side of your screen. Combining conventional cancer treatment with complementary therapies, integrative cancer therapy is aimed at managing symptoms and side effects. I would now like to introduce you to Dr. Caitlyn Keates, who is a naturopathic doctor at the Center for Health Innovation in Ottawa. In this session, Dr. Keates will share with us how multidisciplinary teams can work together to treat the whole person using different therapies proven to improve quality of life by reducing fatigue, pain, and anxiety. Welcome, Caitlyn.
Thank you for that introduction, Stephanie, and nice to meet all of you guys virtually. I'm going to take you through my presentation today on naturopathic integrative medicine in ovarian cancer. So we'll just dive right in. It won't move for me. There we go. So this is just an overview today of what we're going to be talking about. We're just going to start with about me and then dive into what is naturopathic medicine, move into naturopathic principles, go through a visit outline and what that will look like for you if you see a naturopathic doctor. Then we'll move into naturopathic medicine in specific with cancer care, go through how we research and why we research and some of the interactions that we might look out for and red flags there, and then dive into some common symptoms you might be experiencing with ovarian cancer, and what therapies we would use in integrative ovarian cancer to maybe correct those or help with those. And then at the end, I've included a case study of a patient of mine that is currently diagnosed with ovarian cancer and what we're doing with them. And we'll leave 15 minutes at the end for a question and answer period. So this is about me. That's me on the, I guess, left side of your screen. I'm a naturopathic doctor. I graduated from St. Francis Xavier University. I did a 4-year undergrad on the East Coast there in kinesiology. And then I went on to CCNM in Toronto, where I studied naturopathic medicine for the next 4 years at their medical program there. As your last part of your 4 years there, you do an internship. So that's where I started my integrative cancer care training. So I was a part of the Integrative Cancer Center there. And then once graduating, I moved to what used to be the Ottawa Integrative Cancer Center and is now the Center for Health Innovation to learn more about cancer care and natural therapies and how to effectively treat cancer as an integrative approach. So I'm part of the ONC-AMP, which is the Oncology Association of Naturopathic Physicians, the OAND, the CAND, and I'm registered in the province of Ontario under CONO. So this is important when you're looking for a naturopathic doctor because our scope is different across Canada. So each province has different regulations they must follow. So mine is within Ontario, which is the lowest scope of practice. And then it's different, say, for somebody who's in British Columbia or Manitoba looking for a naturopathic doctor. And there's a difference too, I just wanted to point out, between naturopath and naturopathic doctor. So that's something you also want to look out for. A naturopathic doctor has protection title against that doctor title. So they have that 4-year training in naturopathic medicine following an undergraduate degree. Whereas someone who's a naturopath, they might just have sort of a diploma program, or if they've done a few month program, and they might not have the additional training that they need to be recognized as an actual physician in natural medicine. So what is naturopathic medicine? So we are dedicated to the study and celebration of nature's healing powers. It prioritizes the most natural, least invasive, and least toxic therapies to treat illness and promote wellness by viewing the body as an integrative whole. It honors the body's innate wisdom to heal and gives patients the tools for lifelong wellness. And it's defined by principles rather than by treatment options. So I'm going to go on the next slide and take you through. These are what are what our naturopathic principles are. So this is what we guide our treatment approach to. And later on in the presentation, when I take you through how we build our treatment plan, we really take these into account when we're building them up. So each slide will go through each principle and how we will build your program based off that. So the first one being, first, do no harm. We don't want to be negligent with our care. We want to take into account what you're doing conventionally, so that we don't do any interactions or cause any further harm than good. Then we'll use the healing power of nature. We'll identify and treat the causes, doctor as teacher, treat the whole person, and then lead into or emphasize more of a preventative type of approach to care as well. So this is what an initial visit will look like. We have the gift of time that sometimes your regular oncologists or regular physicians might not have. So our general initial intake is about an hour and a half in length. We discuss things like your goals for visit. We'll go through your conventional diagnosis and treatment, some of the dietary interventions that you've already done or started, or just what a typical diet might look like for you. We use dietary measures as a big treatment source. So we want to look into what changes need to be made, because food is medicine as well. We'll look at your lifestyle, things like exercise, meditation, if you're journaling, your social habits, if you're married, your occupation, all of those can reflect your health. So we need to look into those general lifestyle mechanisms. Then we'll review some natural health products that you're already taking, as well as any medications that have been prescribed to you. We'll look at your medical and your family history. So we want to know your whole person value. We don't want to just know your oncology diagnosis. We want to know other things that you might have had in your past or that you're currently experiencing that have nothing to do with your current oncology diagnosis. And then we'll delve into things like sleep, digestion, allergies, your mental health, all important for that whole body picture to really get a sense of how you function and what makes you you. And then we'll do a full, complete review of systems. So we'll start up at the top and work all the way down to the bottom. We'll do things like vision. If you have any changes in vision or blurriness, any ringing in the ears or frequent ear infections, we might look at things like chronic antibiotic use, and we'll delve into even musculoskeletal complaints like back pain or broken ankles or anything of that sort that hasn't been resolved in your medical history that might be of relevance to look into now. So this is naturopathic medicine in cancer care. So we have usually additional training that I'll share a little bit about at the end of this slide. But this is a statistic to start off with from the Journal of Integrative Oncology. So over 80% of people with cancer are choosing to use natural and supportive therapies alongside their conventional treatments. As I'm sure a lot of you, without even knowing, you probably already have natural and supportive therapies in your general lifestyle. When it comes to cancer care, outside of the conventional diagnosis of chemotherapy, radiation, or surgery, or immunotherapies, or things like that, you might be looking into what are some other ways that I can make myself healthy. And that's why that's such a big statistic, with 80% of people choosing that. So we, with more of a focus in cancer care, advocate for collaboration with conventional providers. So I am a very integrative practitioner. I'm not an alternative option. So I will work with your conventional provider and your conventional diagnosis, and I'll complement that and work alongside that as an integrative approach. So we want to make your conventional provider and make your conventional plan work a little bit better. We might help you out with things like reducing your side effects to your treatment, help optimize your conventional care, prevent recurrence. So these are just all things that will take into account that might be your goals as well. We provide evidence-informed guidance on safe and effective use of natural and supportive therapies when combined with conventional care. So we are using evidence-based medicine, and that's something we'll discuss in the further slides as well. But we truly don't want to provide any negligent care. We want to make sure what we're providing to you has been researched and isn't going to cause more harm than good. So this is the next slide, or the next question about how to find an ND who focuses in cancer care near you. So I'm going to just exit out of this and show you, there's a website here. When I was talking about the association I was part of, the ONC-AMP, you can just type it into a Google search and you can click find an ND. And then here, all of it will pop up, and you can, based on your map, you can find wherever you are located, and you can find the ND closest to you. Now in the second section here, it says FABNO designation. You'll see that listed here as well, display only FABNO. So this is a separate designation that people or naturopathic doctors have been given the ability to write an examination based on the amount of clinical experience they have in cancer care. So to get a FABNO designation, or to be able to sit for this examination, you have to have either done a residency following your completion of naturopathic medical school in oncology specifically, and you have to have meet the requirements for that residency. Or you've had to have seen so many oncology cancer patients and have done so many research studies. And then you are able to sit this examination and get this designation, which stands for the Fellowship of the American Board of Naturopathic Oncologists. So these people are truly, they have a big focus in oncology care, and that's really what they practice and what I myself am working towards. So when to see a naturopathic doctor, we can really provide you support at any phase of your care. Say you have a strong family history of cancer, and that's something that you want to try to prevent from happening. One of our principles was preventative care. So we work very closely with a lot of people who have that as one of their goals, is to be the healthiest they can to prevent cancer onsets from even happening. We can work with you at the time of your diagnosis to help you prepare for what lies ahead, what treatment you're going to be going through. We can work with you during active treatment to reduce any side effects or potentially improve your response to your conventional care. Or we can work with you post-treatment to help you recover and support prevention of recurrence with some healthy lifestyle education. I think this is the most important part of your important phase of care, because you've just gone through quite a lot. A cancer diagnosis is almost like a personal trauma, and it takes a lot to get back to where you were prior to your cancer diagnosis, and trying to understand who you are now and how you feel now, and getting rid of those residual side effects and moving forward with your care. And I think that's a really important part of your treatment, is that post-treatment phase. So this is where we talk about evidence-based medicine. So I come from a center where we do a lot of clinical evidence. I'm part of the research team there. I'm part of 2 active trials right now. So we are constantly pumping out research from our center, and we work alongside the Ottawa Hospital and things like that. So we really emphasize, and I personally emphasize this a lot in my treatment plans, things that are evidence-based. So we're not just looking at those clinical trials or clinical experience. We want things that are those randomized controlled trials that have been studied in humans, and that human data is what we're looking for to help guide our treatment principles. So I know a lot of my patients, they come in and they say, oh, I saw this on a forum and I really want to take this, this supplement alongside my my conventional care. They said that it worked really well for them on the forum, and I think that I should take it. And you need to, what I always tell my patients, that you need to understand that just because it's natural, it doesn't mean that it's not going to interact with what you're already taking conventionally. Natural products can just cause as much harm as a medication that you're not supposed to be taking with your conventional care as well. And it really is an area where you should speak to a naturopathic doctor, somebody who has training in dealing with oncology, or able to do interaction checks and things like that, just to make sure that these supplements that you are taking, or these natural health products that you're taking alongside your conventional care, are safe to be able to take. So that's what we do there, to prevent more harm than good. Evidence-based medicine is also really important for us as physicians, and for you as patients, to be able to go to your oncologist and say, I'm taking this, and this is the research behind it and why it's being prescribed. So they, as the oncologist, are able to look at it and say, okay, it's okay to take, or no, I would rather you not take that, regardless of the amount of evidence that you've presented me with. They are the people who are, they're the highest on the chain there, and they make the most decision regarding your care plan. So we need to respect that, but at the same time too, we provide them with the evidence-based medicine and the backup around that, to make sure that this is why you're taking it, and it's going to be safe. So it is growing. Research is continuing to grow in our profession. Like I said, we have lots of studies coming out of our clinic all the time. They're largely guided by single intervention randomized controlled trials. We usually aim for the highest quality human data for clinical decision making. So this is looking at natural therapies in humans with positive outcomes for improved quality of life, symptom control, treatment response, and survival. So those are the main clinical outcomes we're looking for. And this last point here is just talking about the KNOW database. So this is, I'll show you what it looks like. This is a website that was designed by, it's actually in partnership with the clinic that I'm part of, but it is designed by a bunch of different naturopathic doctors, and they go through on a daily all the available research that we have available to us. And we're able to look through these studies and know clinical pearls and interactions and all of that, so that we're using the best evidence for your treatment plans. And it's updated constantly and with new research. And that's one of our large databases as a naturopathic doctor who practices with oncology. So this is interactions. So this is one of the big things that we are looking for as well. As I mentioned earlier, we're medically trained on conventional drugs. We have 120 hours of pharmacological training. This is because our scope varies across the province. So in British Columbia, they have a large scope. They can prescribe almost every conventional medication there is, except for a few oncology drugs. In Ontario, we have a very small prescriptions prescribing license, so we're not allowed to prescribe any pharmacological drugs here in Ontario. So we need that training when we go through school to understand those prescription authorities and when to prescribe and when not to prescribe. And it's important with oncology as well to understand why those drugs are being prescribed and what will interact with them when we're using natural agents as well. Like myself, I have additional prescription authority. So in order for these physicians, these naturopathic doctors, to prescribe these medications, we do have to sit a prescribing licensing exam following our medical training. So we have additional pharmacological training, and then we have to write an additional examination following our graduation of the college to be granted this prescription authority. And like I said, in British Columbia, they have a huge amount of things they can prescribe. In Ontario, it just includes things like desiccated thyroid or topical estrogen or progesterone or higher doses of vitamin D or B12 injections, but it also allows us to sit an IV examination, which is one of the main treatments that we use in oncology care. Then we have interaction checking databases like Medscape and Natural Medicines. Memorial Sloan will put all your prescription drugs that you're taking and everything we want to prescribe in there, and then it will tell us if they interact or not. So I always do this with all of my patients before I submit their treatment plan, just to triple check. We usually know what's going to interact and what's not based on training, but I always just like to make sure before I send everything off. So moving into ovarian cancer. So I'm sure you know the common signs and symptoms that you might be experiencing when you're diagnosed. Things like fatigue, persistent pressure, weight gain, frequent urination, back pain, gas, bowel changes, difficulty eating, vaginal bleeding, painful intercourse. So this is the typical picture of what ovarian cancer might look like. It might not, but that's pretty standard. So now I'm going to take you through the principles and how we would treat it. So this is the first do no harm. So this is why we do a complete intake for that hour and a half. We want to make sure we know everything so that we will cause no more harm than good. We note your conventional plan. We do our interaction checks, and we design an individualized plan based on what you're taking, what you're experiencing, and what you might need moving forward. And then we'll talk about the next principle, identify and treat the cause. So with identifying, we need to understand what are the modifiable risks and what ones are unmodifiable. That will help with our treatment. So usually in oncology, the cause is typically unknown, but it could be maybe the BRCA gene, with BRCA1 having a 39% risk, or BRCA2 with the 11 to 17% risk, or the Lynch syndrome, or never being pregnant, smoking, obesity with over 30, vaginal douching. We know that increases risk 2 times the amount. Hormone replacement therapy like estrogen alone can increase your risk, but we know oral contraceptive pill might decrease your risk, with 20 years post discontinuation still showing a decreased risk. So just a few things there to help us identify what's going on. We can point out things like your BRCA gene are going to be non-modifiable. They're going to be harder for us to modify. But things like obesity or hormone replacements, all of those we can modify, correct? So they might help us a little bit with our treatment. And then treat the cause, with the cause being ovarian cancers. This is the conventional diagnosis or the conventional treatment plan that you might be put on. Things like neoadjuvant chemotherapy before your surgery, like carboplatin or cisplatin, paclitaxel or docetaxel. Then we'll get into our surgeries, the debulking surgery, oophorectomy, salpingectomy, or the adjuvant chemotherapies, which are similar to our neoadjuvant plans. Or we might look at the hyperthermic intraperitoneal chemotherapy. I'll talk about, this is the conventional one. The natural care we'll talk about a little bit lower in this slide when we talk about a different principle. Doctor as teacher is the next principle. So like I said earlier, we have the gift of time. We have an hour and a half with you. So we're able to learn more about you and learn your goals a little bit more, but also explain your conventional plan. A lot of my patients, they don't understand what they're taking, why they're taking it, some of the side effects that they could expect on it. So a lot of times I'm explaining that to my patients so they know what's actually going in their body, or why it's going in their body, and what it's doing. And I think that's an important part of your cancer diagnosis and getting better, because then you understand what's going on inside of you to help you feel better. I get to explain my naturopathic plan to you too, with a full informed consent. So that will look like what I'm prescribing to you, why I'm prescribing it to you, any alternative options that I might give to you, the price of it, the side effects of it. And that's a full informed discussion, because that way, at the end of the day, you can make the decision of whether you want to take this or not. And then the next one, treat the whole person. So we're doing a comprehensive intake again to figure out everything about you, not just your cancer. We're going to ask you your goals of therapy. Sometimes you might not even want to treat your cancer at all. You might, be coming in because you just want to balance your thyroid hormones. It has nothing to do with your cancer at all. So we have to make sure we're on the same page. We'll ask your past and your family medical history so that we know what has gone on as a whole. Again, going back to not just your cancer. And naturopaths, we like to do a lot of additional blood work because we have different ranges that we like the standard patient to be in that might be a bit different than your medical doctor or your oncologist. Because if, for example, like insulin, your HbA1c, we don't want it at 7, 8.5. We ideally want it around 5 because we want that to be a preventative mechanism. We don't want it to be sitting at the higher end, but still within range. Why not do something about it now before it happens to become a problem? So that's, we do some additional blood work maybe that your family physician or your oncologist hasn't run. Like vitamin D is a big one that we run. We love to check vitamin D status. It's very important in treatment. And so we might run some additional blood work there. And then the healing power of nature. So how do we treat this naturally? We look at dietary, supplemental, lifestyle, and injectables is usually how I like to break them down to my patients. So let's look at surgical. I usually hand out a pre and post surgical plan. I put it on a 1-page sheet for you. And it goes to all my patients so that they know what to expect going into surgery and how to respond based on what comes up. Some of the modalities that we'll look into might include homeopathics. So I don't use homeopathics very often in my practice. Really, the only time I use it is with surgery. I might look at arnica as one of them because we know that arnica, homeopathics in general, there's no interaction, so it's not going to interfere with anything that you're on. But arnica is for that bruised feeling. It helps you feel not so beat up after surgery. It helps you recover a little bit quicker there and feel a bit better. Massage, I always recommend because we're working on the muscle before we make an incision. So we're just relaxing all that muscle. It helps with the scar tissue buildup post-surgery. And post-surgery too, I recommend it as well because it helps with that scar tissue again. Acupuncture, I use this throughout all phases of treatment. Acupuncture is especially great surgically because it helps to reduce the duration of hospital stays. And that's where the research lies surgically, really is just that hospital stay duration. Supplements, protein supplementation is important through any stage of a cancer diagnosis. I talk about this in dietary interventions with my patients all the time. We know when we have cancer, our protein requirements actually increase. So they go from a gram of protein to about 1.3 to 1.5 grams for every kilogram of our body weight in protein supplementation. So we need a lot of protein when we have cancer. We need that for immune function. We need those amino acids to maintain weight. We need it surgically though, because it's involved in the tissue factors for remodeling. So we need that protein there. And it keeps our immune system nice and high. So we're preventing things like infection and sepsis from happening post-surgery. ACEs plus zinc is a tissue remodeling support. So ACEs, I like to prescribe ACEs plus zinc. It's vitamin A, C, E, selenium, and zinc. These are all vitamins that are required to build up our immune system, but are involved in things like collagen production. They're involved in cell communication, so cells can be able to go to the area they need to clot and build tissue back like they're supposed to. Vitamin D status is another thing I look at in all of my patients, like I was saying. So vitamin D, we know those who are deficient in vitamin D, which is majority of us, we have just better survival outcomes when our vitamin D status is where it's supposed to be. We have better immune systems when our vitamin D status is where it's supposed to be. And when we look down below to that lifestyle, where it says room exposed to sunlight, there was a study that showed that those who had a window room and they were exposed to sunlight, they actually recovered quicker and had less complications. And I think that has something to do with the vitamin D status there. That's what they proposed in the article. Probiotics we use frequently in surgery. We're getting a lot of antibiotic exposure. So we just like to replenish that gut microbiome, and then guided meditation for fears around surgery. And going back to fears, homeopathics, we use a lot of homeopathics for those patients who just have those lingering fears with surgery as well. Common side effects, I'm just checking time. I'll go through these quickly. Doxorubicin, cardiotoxicity. They do the chest x-ray and everything before you go in and get doxorubicin. So that they're trying to prevent that cardiotoxicity from happening. CoQ10 and L-carnitine are great for that, but they do interact with chemotherapy. So this is one thing you can't just take. You have to have a naturopathic doctor monitoring you and telling you when you can't take CoQ10 and L-carnitine for that cardiotoxicity support, because these will cause interactions. Hand and foot syndrome is another one. With hydrotherapy, we might use B6 or acupuncture. Neutropenias with Coriolis, Gandoderma, agaricus. These are all mushrooms that increase our immune function and prevent those neutropenias from happening, or those white blood cell dips. Vitamin D status, again, mistletoe. I'll go through that in a few slides from now. Nausea, we look at, you're given usually a slew of anti-nauseant medications. I usually see patients on 4 to 5 at a time, but ginger, acupuncture, acupressure, we might be looking at those. Fatigue, protein status, again, we look at that. Vitamin D status, important there. We might look at CoQ10 and L-carnitine again, because we know they're involved in that mitochondrial production of energy. So again, with the interaction there, we just have to monitor that. And then mistletoe, again, it's true bread and butter with mistletoe is helping with fatigue and general quality of life. Alopecia is a big one I see with my cancer patients. Hair loss, they don't want to lose their hair. Agaricus mushroom is maybe one that it's one thing that we can't prevent you from losing hair, but we might be able to make it come back a little bit faster. And then the chemo or fog brain is a big one that I see very often as well. And we know the DHA and the omega-3s can pass through the blood-brain barrier and help out with some of that. But also the EPA will help with systemic inflammation that can contribute to the cancer growth. So lots of supplements. You can go on for days about supplements that help. But when we look at our injectable therapies, IV vitamin C is, I'm sure, one that you've seen fairly often. When we take it orally, it's an antioxidant. When we take it in high doses as an IV therapy, it is a cytotoxic agent. So it's having effects on cancer cells, but not on normal cells. So in high concentrations, vitamin C appears to be selectively cytotoxic to cancer cells, and that's through the generation of hydrogen peroxide. So cancer cells, they lack the catalase and glutathione peroxidase enzymes to convert that hydrogen peroxide into water, and the water that can then escape the cell in a regular cell. But in a cancer cell, it can't. So this is what causes that cytotoxic effect. And we usually check your G6PD enzyme. We need to see if that's in there, because that's what helps to get rid of this vitamin C through your cells. So in research, they saw that IVC in combination with paclitaxel and carboplatin may improve time to relapse, so 8.75 months longer, and survival in patients with advanced ovarian cancer. And I know a lot of your oncologists absolutely hate when you're put on IV vitamin C. So this point is to show that majority of preclinical evidence has shown that there is no decrease in efficacy when used with chemotherapy agents when administered in combination. In fact, in vivo and in vitro studies have demonstrated vitamin C has additive therapeutic effects with various chemotherapeutic agents, including some of the chemotherapies you most likely are on. Just to be safe though, and avoid that interaction, we are all trained to administer 5 half-lives away from your chemotherapy. So we'll calculate that and administer it appropriately. And we know the half-life of IV vitamin C is 2 hours. So we'll advise you, we'll schedule you in based on when your chemotherapy is to avoid any interactions there with the IV vitamin C if it's something you do decide to move forward with. Mistletoe, like we were saying earlier, is our immunotherapy in natural cancer care. It's hypothesized that mistletoe could cure cancer based on the observation it's a parasitic plant that eventually kills its host tree, paralleled with the progression of cancer. So there's a viscal toxin and a lectin. These are the 2 agents that are involved in its inhibition of growth, as well as its immunostimulating effects. So there's a slight raise in temperature, which warms the whole body, like when you have a cold or flu. And that's what means our immune system has been stimulated. So we select it based on the cancer type. There's different plants or different trees that we select the mistletoe from. And its true bread and butter, like I said, with the research there is to enhance, this one's actually enhanced prolonged overall survival, but clinically, I usually see improvements in quality of life, fatigue, neutropenia, and it's great for bone pain. So this is my case study of my patient, MG. She's a 62-year-old female. She had ovarian, she's still with us, ovarian cancer stage 4. She presented to me with pleural effusion and ascites. She had a history of a right lung collapse and genetic testing was negative. She is taking, I forgot to include it there, but a taxane-based therapy. She's currently on 50 grams of IV vitamin C, plus IV mistletoe type M. She's at 500 milligrams currently. And she's also taking things like Coriolis, theracumin, a whey protein, vitamin D3K2, green tea extract, fish oil, and I3C. So her sister is actually a nutritionist, a holistic nutritionist. So she came already taking the I3C and the vitamin D. We just added in a few things there. She's on an UNDA protocol. Her sister put her on for pleural drainage. And currently her white blood cells and red blood cells are all stable throughout treatment. She is doing neoadjuvant chemotherapy right now. She's just about to go into surgery, so for a complete debulking surgery. So we just switched her plan to a pre and post surgical plan. All her ascites and pleural effusion have resolved. Her cancer antigen has reduced from over 5,000 to 380 currently. I just asked her literally last week. She has a healthy appetite. She has tons of energy. She goes kayaking and walking after every chemotherapy treatment. And so she's doing really well with an integrative approach to care. Almost a little bit alarming how good she's doing. I'm very proud of her. And that's all. That's all for my presentation today. So I've left only a few minutes for questions, but I'm here if we have some extra time.
Thank you so much, Dr. Keates, for that presentation. So informative, and I know I learned a lot from it. So we do have a couple of questions. First one, I'm going to ask here, are the consults and treatments covered by provincial healthcare plans?
They aren't. So we're not covered by, in Ontario, it's OHIP. So we're not covered by your Ontario health insurance plan. But if you do have additional benefits through work or through an organization or personal, most do have naturopathic options. And even they do have additional for laboratory work sometimes as well. So you just have to check with your insurance provider.
Great, thank you. Another question here, just asking if you can state again the amount of protein needed daily.
Yes, so regular, or with ovarian cancer or with any cancer patient, it's 1.3 to 1.5 grams for every kilogram of your body weight. And that can be a mixture of animal or plant-based proteins. And a lot of times we like to reduce the amount of animal-based proteins and kind of increase our amount of plant-based for cancer.
Thank you. One more here. Are there any studies showing if vitamin C and mistletoe can be used if taking Zejula?
Zejula. Let me look up.
While you're looking up, Caitlin, I just actually wanted to read a couple of comments that were in the comment section. So I apologize if I'm turning. I'm just looking on my other computer here.
Yeah.
I'm seeing a naturopathic doctor, and as someone working in science, I really appreciate their evidence-based treatment plan.
Amazing.
Another comment, I have been a patient at this center since my diagnosis in 2013. They have been so helpful.
Perfect.
And I've got one more I'm going to read here. I've been seeing a naturopathic doctor for 30 years, and she has been an integral part of my medical team throughout my cancer treatment. Sometimes I simply go there for a sounding board. So thank you for those great comments.
Yeah, thank you everyone for sharing. With Zejula, it's not, we like to avoid, if you're already doing an immunotherapy, that's when I don't recommend this. So there's no specific research with Zejula, but I wouldn't see any harm in it because it is, it's not an immunotherapy in general. So it wouldn't cause any inhibitory effect, but there's no standard clinical data on its use specifically with Zejula.
Okay, thank you. I just have one more question here. I was advised by my oncologist pharmacist not to continue with the vitamin C's from my naturopathic doctor while I'm on cyclophosphamide. Can you comment on that?
Sometimes the oncologist or the pharmacists are a little bit harder than the oncologist. If they've advised, then I always respect their opinions. So, you know, if that's what you think and that's what your oncologist thinks is the best for your care plan, then I would follow through with that. Medicine is individualized though. So if you feel like personally it should be of advantage to you, then you can always take a look into it further and speak with your naturopathic doctor or anything like that and see if the risk versus harm is better or worse. Oral supplementation of vitamin C, a lot of times they tell you not to take that at all. And I even say don't take oral vitamin C when you are on chemotherapy, just because it is an antioxidant in that form. In an IV form, it's a pro-oxidant. So it's not resisting what the chemotherapy is trying to do. It's working with it.
Thank you. For post-cancer hair growth, what do you recommend?
Yes, anything that can stimulate it. Stimulate circulation to the area. Hydrotherapy, so hot and cold on the head. Castor oil I've used a lot of. Any massage to the area. The agaricus mushroom has been shown in natural therapy to maybe help a little bit too. But it is very, very difficult to treat. So you just have to be patient. And I always tell my patients that it's going to come back and look totally different. So, you know, maybe if you had straight hair before, you might have curly hair now and absolutely love it. So just be patient and it'll come.
Thank you. So that's all the time we have for questions. I want to thank you again for that awesome and informative presentation. And I wanted to remind everybody that's listening today that Dr. Keates has kindly posted her presentation at the bottom of the session. So if you just scroll down to the bottom, right below her bio, you'll see that there is a section called Files, and her presentation is in there. So I know some of you are asking about websites. You can find that information in there. So thank you again, Dr. Keates, for joining us on your Saturday. We really appreciate it.
Enjoy the rest of the conference, everyone. It was great to meet you all virtually.